Hello and welcome to Mayokun MA. It's always a pleasure to have you join us as we discuss topical issues that affect us, some of us, and at times it affects all of us. Today we look at a very touching issue. Somehow, if you look around you, you likely would have noticed a special need child, or you might even be a special need child yourself, or a parent to one. Or you've seen them, but you just don't know that they are unique and they need a little bit more of our understanding. And maybe some of us would even fare better if we have a way of knowing how best to live with them, how best to relate with them, how best to parent them. Some of us actually grew up with them, so it'll be good for us to enlighten ourselves better, to understand their world, and how can we can bring in some inclusion. How can we be better, create a better society to have and to raise and to manage special needs children. And to do that with me is Bukola Ajiboye, a colleague, a friend, and someone who is also knowledgeable in this respect. Apart from being a broadcaster, we've worked together before. Apart from being a broadcaster, she's also and let me allow her to, in the course of the program, you get to understand how she's thought and worked and is still working with quite an array of children. Some of them special needs and some of them, going to. But you hear all of that from Bukola. Bukola, good to have you on Mayokun MA.
Thank you very much, Lady Mayoko,
Thank you
my
for your
producer
time.
of Talk Nigeria. Thank you for having me.
Okay.
Thank you once again.
All right. So let's start this way. While I was growing up, I remember I knew someone who had a special need, but as at that time I didn't know what it was. It was awkward to me, and nobody could explain to me what was going on. I just felt odd, sometimes pity for the child, but no one actually sat me down to explain things. Why is our society like that? Is it out of the fact that we don't know, or we don't know how to embrace it or how to confront it? What do you think is responsible for us not knowing how to actually cater or manage or live with children with special need?
There's something our society believes about children, and that is children must come in perfect packages.
Well,
A baby must be born perfect. And when that is not the case, we naturally shut down. We live in denial, especially for a baby that is born differently abled. When we talk about physical differentials in terms of ability, then it's we try to adjust with it, a bit of it. But it's worse when it's a neurodivergent child or baby that is born. When we talk about neuro challenges or neurodeficiencies, it's a challenge for us. Now, I'll shock you. The African person believes that a child must be had. It's not that we really understand what it means to love a child or like a child, but it is part of the circle of life as Africans. And it must, follow that pathway that you marry and then you have a child. Or in some customs, you may not marry, but you can have a child. How the child comes is not even put into consideration, or the package the child comes in. They just believe that a child must be perfect. So when a child is born differently able or neurodivergent, then it begs the question: what happened? Did you, offend anyone? Maybe there must be somebody from your home, that Nigerians will call village people, village people who are after you and all that. So in this case, this is where the issue of denial comes in, because there's a picture perfect expectation that a baby is born perfect. 2 eyes, 1 nose, 1 ear, 2 arms, 2 limbs, can walk, should walk when, as it went due, must pass all the milestones. And if one is missing, there's that denial that, no, it can't be my child. Something must have happened. Let's go from one prayer house to another, and that kind of thing. So denial is the first thing. And then with the perception that the baby is born perfect. So that's just the challenge a lot of parents have when it comes to accepting.
Okay.
Yes, a lot of people, parents, family members have when it comes to people who are neuro-divergent or differently abled. So that's just it. Case of denial and case of denial and that perception of a perfect
baby,
a perfect picture child. Yes,
I love the way you captured it. Differently abled. Differently abled. I love that phrase. I read up. I have
the United Nations plays down a lot on the use of special needs. Of course, you can use it, but then it's better we say differently abled or neurodivergent.
Differently abled. Okay, I'll lock that in so that I'll rather refer to them as differently abled or neurodivergent. Here I have it that in clinical diagnostic and functional development, special needs refers to, please permit me to still use that term, refers to individuals who require assistance for disabilities, and it may be medical, mental, and psychological. Those are the kind of assistance they have. A child is said to have special educational needs if they have a learning problem or disability that make it more difficult for them to learn what children of their age would have learned. They might have problems with schoolwork, communication, or behavior. They may have learning difficulties with communication. Yes, we've said that, and sometimes they require speech and language therapy to improve. Let's just identify some of these conditions. It can range from autism, I believe, Down syndrome, dyslexia, cystic fibrosis. There are so many names. Even anxiety.
There's also ADHD.
ADHD.
Attention deficit. Yes.
That I think in that case, can you define that for us or describe what ADHD means? Attention deficiency.
Okay. That's attention deficiency. Hyper deficiency.
Okay.
That's attention hyper deficiency. So that means that the attention span of the child is so short that they really can't sit still for too long.
Wow.
Sometimes they also react to so much confinement. I have a student that I teach. He barely can sit still for more than 2 seconds.
Wow.
So to calm him down, you have to sit beside him, hold his hands, and then draw his attention to what you're doing. And of course, as a teacher, you should also have to package your training in such a way that it's not too long. Make it practical, make it visual. Most of them who are ADHD need more visual pictures, visual trainings, visual lessons than auditory, because they don't have that attention span to be listening for too long.
Those conditions that we've mentioned, thank you. Sorry for cutting in. Those conditions that we mentioned are just a few of those conditions that require children to be differently, uniquely abled. just as you
Yes,
said.
yes, yes.
But there are so many other conditions, cleft lips, missing limbs.
Yes, yes.
There are so many other conditions that in our society, if a child is born with that condition, um, it is treated as an anomaly, just as you said. Now, let's look at how parents, yes, the denial stage has been passed, and then the parent starts to come to terms with this child. What, in your own experience, has been the effect first on the parents as they start managing? I don't want to use the word cope, but managing with managing that child. What have you seen the effect on parents? Let's start from parents, then we go to the siblings, and then family.
Okay. I grew up. Let me give you a background story, just to a short one of myself. I grew up in a university, setting, and we lived in the university quarters. Any university kid would know about university quarters. And I knew, apart from me, who has a sister born with the autism spectrum.
Okay.
I know the family who had a daughter with Down syndrome.
Okay.
Now, I'll tell you our approach to it. Well, my parents actually did live in denial because they tried their best, but because there wasn't much awareness about differently abled children, special needs children, way back in the 70s and into 80s, we did the little we could do, try to do an inclusive kind of integration when it comes to education. But that was hard because, again, the environment then is so different from now, where if you had a child who had autism back then or Down syndrome, and you do an inclusive approach to training, it's going to be more of a problem for the child because the teachers don't understand how to raise or relate with that child or teach that child, let alone include that child in the normal school day-to-day activities. Okay, so it's a case of a denial from school again, and denial for a parent that okay, she'll outgrow it. But you forget that some of these conditions are either genetic. Most of them are genetic. Some are the case of a malformation during pregnancy, And so it's not like a cough or a baby didn't walk at 10 months. Let's give her time or him time. He'll walk in, at 11 months. It's far from that. Now, it took a while for us to understand that this condition had come to stay.
Wow.
And that's the challenge for a lot of parents. Even today, where the awareness has increased, there are centers. For instance, the Patrick Language Speech Center is helping children from autism, ADHD. I know of someone who's dealing with children that have cerebral palsy. She trains parents that have children with cerebral palsy to know how to handle them.
Wow.
So I grew up seeing my sister different, and I wasn't too happy about that because it was more like everybody sees her as she's different, and then they look at every other person with the same eyes. But now that I think life has a way of throwing you full circle into reality, and that in the course of my diction training, I teach diction in schools, I realized that now the more children actually have special needs.
Wow.
More children are in inclusive training centers, and I must give kudos to schools who are allowing that and are improving learning opportunities for children with special needs. But here's the scary fact. We had special needs children then. Now it's more like 70% to 30% ratio.
Okay, so you're talking of
yes.
Children with you said I shouldn't call it special needs. So children differently able.
You can call it special needs, you can say that
Okay,
who are differently able or neurodivergent.
yes, differently abled children. Are you saying that the percentage of differently abled children in our schools, the normal schools that we all attend, is up to 30%?
Yes.
30%? Are you
Has
saying?
has increased
Wow.
to 30%. And that's high.
Wow.
If we're looking at schools engagement, when it comes to schools, pupil engagement.
Let's talk about the stigma. Let's talk about the stigma. How has that played out in our society back then and even now? The stigma on the child in particular, and even on the family, the immediate family of that child, the parents. Let's talk about the stigma. Nobody wants to ask. Just give us a sense of what you have to go through and what you have seen played out.
I've seen situations where those families lock up their special needs children. They lock them up when they're going for events. They lock them up at home. They barely allow them to be seen with them in social gatherings. It's usually worse when you have a child who has autism spectrum, where a child has autism and the spectrum is on the wider part. There's some who have a minimal, just tiny, obvious shows that they have autism, and some are on the broader spectrum where they have seizures or they throw tantrums and all that. It's usually hard for them to have a social life, and because stigma is something we attach seriously, we take stigma seriously here in Africa. Any African country, it's so hard that we're quick to dissociate from families that have children with special needs. Some have the erroneous belief that it's transferable, and it's not. Okay? So it's why a lot of parents deny. You'll be shocked that even till now, some deny the children from having any education for fear of stigma. And those who do allow them to have education, sometimes it's hard to even say, parents, please, let's come to terms. This child has special needs. What can you and I do about it? It's more like, that's your problem. That's why he or she is in school. That they have a sense of acceptance in school is more of a relief. But society won't let them be, which is hard. That whether we like it or not, we'll have special needs children, neurodivergent children, differently abled children, and it's sad to say, it's increasing. Like I said before we started the recording, I had to ask a medical professional that I'm scared. We're having more children with autism. The spectrum used to be minimal. Now, on the broader spectrum, we're having children with that. We're having children with ADHD. Mind you, it's even a neuro-divergent challenge now than physical. If it's a physical thing, you can get artificial limbs and artificial hands. You can send them to the school of the blind, school for the deaf, to catch up. And they're catching up well. But it's even more scary when you have children with ADHD, you're having a neurodivergent increase of children. And you're wondering, what is going on? Is it an issue of vaccines given to the children, or is it the parents weren't eating well during pregnancy? Are parents even aware of genetic, malfunctions that they have? You understand that they skipped them